Hi, my name is Mercedes Harwood, and I will be discussing the opioid crisis in Nebraska. I chose this issue because people are dying at alarming rates from opioid addiction. Um, and as a future healthcare worker, it's important to me that we combat the opioid epidemic and start providing more holistic and non pharmacological therapies into patients' care plans. Uh, my personal connection to this issue stems from working with patients who are fighting opioid addiction um, and seeing family members fight those same addictions for many years. It's a tolling addiction to be in, and I think as a future healthcare worker, it's important to see that and work to make it better. So here are just some facts to show why it's so important. So the Department of Health and Human Services declared the opioid epidemic a public health emergency in 2017. The National Institute on Drug Abuse reports opioids were involved in 70% of all overdose deaths. In 2018, there were 48.3 deaths involving opioids in Nebraska, and healthcare workers are on the front line of this epidemic, and also other public health workers. So to get into educated citizen, first topic is effective communicator. So these will be examples of how I showed effective communication related to the opioid epidemic or using non-pharmacological therapies with patients. So the first example, one of my patients was a 54-year-old female who came into the hospital with a suspicion of C. diff. She had nausea, vomiting, diarrhea. The nurse and I completed our first assessment of her for the day and found out that this past month had been very hard for her. She recently lost both of her parents after spending almost 20 years of her life taking care of them. And the rest of her family didn't talk to her. And then now that her parents had passed away, she'd been feeling very stressed, very lonely, and very anxious. The patient was stressed and asking for anxiety medications, and we had administered all scheduled and all PRN anxiety medications that we could at the time. She kept asking for them because she was having a lot of anxiety, and she wasn't due for another dose for a couple of hours. So instead of just telling her, yeah, we can't give you any more right now, we sat down with the patient and talked to her about her anxiety. We asked open-ended questions, we actively listened to the patient, and talking with the patient helped ease her anxiety, and she appreciated that we took the time to try and understand what was really happening. After leaving the room, the patient was calm and at ease. Um, and the patient was so happy and grateful that she was able to just kind of express her feelings in that moment, and that someone was there for her. So in this example, I used verbal communication skills to effectively ask open-ended questions, ease my patient's anxiety, and then I used nonverbal skills, and that was being present through my body language, being open, not looking like I was rushed. My communication skills showed this patient that as a nurse, I was present for her and that I cared about her anxiety and what was happening, and that it's more than just a medication that can combat anxiety. It's being there for people. So, my second experience related to effective communication was when I took care of a patient in Nursing 210. This was like my first clinical day. And a patient was asking for a lot of pain medication, like a lot of Dilaudid. And the nurse thought that she had an addiction to pain medication. So I ended up talking with my nurse and instructor about this experience because I was really confused. I was wondering why we were still giving pain medication, even though she had a history of addiction and suspected to still have the addiction. And they both explained to me that just because they may be addicted to pain medication doesn't mean that their pain isn't real. And they taught me that we do not get to decide who gets medicine and who doesn't. So this really stayed with me, and I'm glad that I asked those questions and got to learn so much from this experience. Um, and like the nurse instructor's explanation opened my eyes and changed my thoughts and assumptions about the situation. So I learned in this situation to effectively communicate with my peers. If I have questions, I need to ask them, and I need to open my mind to the answers. The next section, reflective individual. My first experience, I had another patient that was very anxious and depressed from being hospitalized for so long, and instead of giving her a bunch of anti-anxiety medications, I spent the time in her room to rearrange her room, organize her belongings, clean her room up, and clean the patient up. And the patient reported that this helped her a lot. Just getting that organization and cleanliness really helped with her anxiety. And it's just another example of how using the holistic approach can elevate a patient's mood. By reflecting on this situation, I've changed how I provide care to every patient every day. Now I try to add um, or try to promote a healing environment for my patients without slacking. And from now on, I'm going to encourage my peers to do this and to reflect on situations, reflect on how they would feel if they had to stay in a messy hospital room all day long. And I think it's really going to change how some people can heal. My second example was another patient I had in my oncology rotation. And she was experiencing a lot of vomiting and nausea, and the medications only seemed to help a little. So as soon as I sat down with the nurse and um, the patient, and we reevaluated the patient's care plan to incorporate more non-pharmacological management strategies and holistic pain management strategies. So we talked about different ones, and we decided to use audiobooks and online guided imagery. This seemed to really help the patient um, feel less stressed and less anxious, which in turn helped her anxiety go down. Because, when you're really stressed and really anxious, your body kind of tenses up and your stomach can hurt too, and it was making her nausea worse. So using these non-pharmacologic management strategies really helped, one, distract the patient, and two, relax the patient. So in this example, I displayed my reflection skills after learning about holistic therapies and non-pharmacologic remedies. I was able to bring them to my patient and revise her care plan to incorporate them. By adding holistic and non-pharmacological interventions, I can help patients heal their entire self. It's not just healing the body, it's healing the mind. And healing the mind helps heal the body. So relieving a patient's stress and anxiety is just as important as relieving a broken arm, you know? Okay, and then the last section, change agent. Um, and these experiences will be change agent related to the opioid crisis again and non-pharmacologic therapy. So the first experience, a patient was having trouble weaning off Dilaudid. And as you know, you can't leave the hospital on Dilaudid. If you're still on Dilaudid, then you're having a lot of severe pain, and that can mean that something else is going on. That can mean that there's a complication. So it's important to wean off the Dilaudid, and my patient wasn't doing that, which was keeping her hospitalized longer. So I talked with the patient, and we decided to try and use more non-pharmacological therapies around the clock, kind of like we do with acetaminophen or ibuprofen. We we tried to stay ahead of them to control her pain, which helped. So we were using hot packs, we were using quiet environments, healing environments. She liked guided imagery as well. It's distraction does help. Um, and in this example, I learned there are new and alternative interventions that we can use in the acute care setting to manage patients' pain. If we don't start doing these now and incorporating these therapies, more people can develop opioid addictions. It happens so fast. So weaning people off the Dilaudid sooner is very important, or hopefully not having them on Dilaudid in the first place. Although, pain does get really bad, and if it's needed, it's needed. And as a change agent, I want to keep devoting my time to changing how we manage pain, changing how we incorporate pain management into patients' care plans. For my second example, this is kind of more general. Throughout my time at Methodist College, I had been studying the opioid epidemic. I've learned a lot. I've been studying pain management, patient care, and learning about all these encouraged me to start making changes in how we deal with opioid addiction in acute care settings. And learning about being a change agent from this, I want to continue to educate my peers on the opioid epidemic and change the way people see pain control. So, when I go out into the workforce, I want to start committees, join committees for opioid education, because I think it's important not only to educate my peers, but also make sure that every patient gets educated. And in conclusion, I think education is the most important preventative practice in combating opioid epidemic. We need to educate providers, nurses, and all hospital staff on the importance of non-pharmacological pain management. It starts with us, and then we also need to take the time to educate every single patient on opioid addiction, and on pain management, instead of just saying, these are very highly addictive, but here's a 30-day supply. We need to teach more non-pharmacologic therapies right up front so they can take those strategies home with them. And that concludes my presentation. Thank you.